Autism is not a puzzle nor a disease. Autism is a challenge, but certainly not a devastating one. Ari Neyman.
Join me as we jump into the Autism Navigation Pod. You mentioned that you didn't really know anything about ABA. Did you want to expand on that at all?
Yeah, so we'd never really heard of it before. And so when they said it, my first instance is let's go to Google. And I start Googling things. I know a lot of people probably don't necessarily do that, but I also know that there's some pitfalls with Googling ABA services because there are some nightmares out there that people went through. And I know that we started joining Facebook groups almost immediately after the diagnosis. And there were a lot of people out there advocating against ABA services. Several of them were people with autism who went through it 15, 20 years ago, when it was still in its infancy program stage wise. And they had some really strong words about it because in some instances it was really abusive for them. And so I think we were scared and at the same time curious about what it was going to look like because it seems like there's so many definitions out there.
Well, and I do think that doing the research is a good thing because you need to know what both sides of the coin are going to look like. And because we had done the research and we saw that there were good and bad reviews, when we finally started the therapy, we asked questions up front. We made sure that we were watching and keeping an eye on things. We didn't just blindly send our child off with these people that we didn't really know. And we would ask, well, why are you doing it this way? Or what's going to be your procedure if this type of thing happens and things like that. So definitely go into it with some knowledge and also with questions. I think that's one of the biggest things. I know that one of the questions I asked was about restraining. What is your policy on restraining? Do you allow restraining from the RBTs? If so, have they been properly trained? What kind of techniques do you use? Things like that. So that way we know from the start what the policy is, what the plan is. And, I was very pleased with the answer that we got as they do not want to use any sort of physical unless it's absolutely necessary. The child's going to hurt themselves or someone else. And I don't think we ever really needed to use anything physical with either of our kids. They would just get put in their room and the RBT would just stay right there at the doorway and just ignore what was going on as long as everything was safe. And so, just going in there absolutely prepared with questions and not being afraid to say, why are you doing it this way? Or, bringing things to their attention so that they know whether you're okay with what's going on. And if you have that knowledge of why something's being done, as long as it's not injuring or endangering the child, it can be a good thing.
And I think too, something else to add on to that, not only just having questions, understanding what your boundaries are as parents for your technicians and BCBAs working with your children, as well as understanding before you jump into it, what are your goals as a parent? What do you want to see come out of these services? And understanding clearly what that end point is so that when your BCBA sits down and level sets with you, you have a clear pathway on what success looks like to you. Because it looks different to every parent out there. And some parents want some things to happen and other parents want other things. And so you have to sit down and think about what it is you want these services to accomplish before you get started so that you can clearly delineate that to your technicians and analysts.
Well, and also to kind of add on to that, how he was saying, you need to understand what your role is. When you have the RBT or the BCBA there working with the child, you need to take a step back. And it's at that point, it's kind of the RBT and the BCBA that are in charge to a degree. We would be there, we would oversee a lot of the things, but ultimately, once they were in their therapy, we kind of took a back seat, and what the RBT or BCBA was asking is basically what went. And they were respectful, and if they knew it was something like, can they have a treat or something, they would ask us first. But in terms of the actual therapy and them saying, I want them to stand up and jump 3 times. If the child didn't want to do that, then we would say, oh, you need to listen to them. They're in charge right now. And you can't undermine the person that's working with your child, because then what they're trying to do is just going to be worthless. It's not going to be anything for you.
You need to reinforce their authority while they're there.
We have another really great guest today. Her name is Dr. Robbie Hanson. She's a board-certified behavior analyst at the doctoral level, or BCBAD. She earned her bachelor's degree from Central Michigan University, her master's degree in applied behavior analysis from Western Michigan University, which is a very repute program, by the way. She earned her PhD in applied behavior analysis from Endicott College. She's got 15 years as a practitioner in behavior analysis. She's got 10 years as a professor teaching graduate level courses at Lindenwood University. She's a research associate for the Verbal Behavior Research Laboratory at California State University, Sacramento. Along those lines, she's also the secretary for the Verbal Behavior Special Interest Group for the Association for Behavior Analysis International. She's got, in addition to verbal behavior, more areas of interest, including comorbid diagnoses, functional behavior assessment and analysis, and severe maladaptive behavior. Personally, she's been a wonderful mentor to me, and I'm so grateful she's carving out a little time in her day to join us. So thank you, Dr. Hanson, and welcome.
Yeah, absolutely. Thank you for having me.
So we know one of the most common supports for the autistic community is applied behavior analysis. Can you just give us an overview of what applied behavior analysis is, and what maybe some of the common ways it's used are?
Yeah, definitely. So applied behavior analysis, or ABA as it's commonly abbreviated, it's really just a way of teaching. So it's looking at what's currently happening, what do we want to happen instead, and how do we make that happen? And it's really a systematic way to go about that, in terms of how can we set up the environment to teach this new skill or help this person be successful in this environment. What can we add? What can we remove? How can we give this person the skills that they need to live the life that they want? So it's really about giving people skills that are meaningful to them in a very data-driven, empirically validated way.
Awesome. I love that. And I think that's one of the most important things, is to have people be involved in creating their own goals. What are some of the common ways that you can ensure, as you're using ABA to teach, ensure that the person is engaged or completing meaningful goals for them specifically?
Well, we look at, a couple different things typically. If it's a young learner, where, they have a parent or guardian that's responsible for them legally, or a caregiver of some kind, we want to get as many people involved as possible that have a meaningful relationship with that consumer. What's important for the family dynamic? What's important for the client? We look at assent. So assent is really important. And that can be assessed in a variety of ways. It doesn't have to be necessarily the client saying, yes, I'm on board, which would be a version of that. But we can assess if somebody is willing to participate and if they're excited about what they're doing through behavior other than words. So do they run up to the one-to-one therapist when they get to the house and excited to see them? Are they willing to come over and engage with the person working with them? Are there any maladaptive type of behaviors occurring right when session starts, for example, that would indicate that they're not in a good place maybe right now to participate? So we look at all those things to indicate, is the client happy? Are they involved? Does it appear that they want to be there? And then are the things that we're doing also important to the family and the caregivers as well? Because we need to make sure we incorporate everybody who, again, has that meaningful relationship with that consumer. That's kind of a long-winded answer. I hope that answered it.
Yeah, absolutely. And I think it is just so important. I think those are really, really valuable points. So other than talking to experts like you with all of your experience, how can families find other information about either autism or ABA in a reliable, maybe responsible way? How can they find those resources?
Yeah, there's a couple different avenues, and it greatly will depend, honestly, on where you live, because it will differ in terms of the types of services. Pretty much across the nation, at least in the United States, we know that insurance is responsible for covering most of ABA services. So there can be some good resources through the actual funder at times, especially if you have a child or you yourself are diagnosed not only with autism, but maybe something else as well, where you're seeking out now speech services or occupational therapy or physical therapy, what have you, or counseling services, for example. So those can be good resources for just additional services. But in terms of getting information about applied behavior analysis and autism, there's a lot of parent advocate groups out there. There's a lot of legally based advocate groups out there. But you do need to be careful because there can be some misinformation involved depending on the group that you're looking at and where the information is coming from. So there are a lot of supports out there. In California, for example, we have regional centers, and there's advocates within the regional center that provide those type of services to just help parents and consumers navigate the world of autism and what goes into ABA and what does it mean to receive an autism diagnosis? What do you need to do next? So seeking out those supports from your funders or other places like regional centers and support and advocate groups is going to be important. But again, you just need to be careful.
Mm-hmm. Are there any like buzzwords or like really any obtuse in your face things that make you think that maybe this resource, this article, this blog post, whatever, may be less valuable or less reliable?
Yeah, pretty much anything that is claiming to have a quick impact or a quick effect in terms of the skills that you want to see with either your child or you yourself if you are the consumer. Anything claiming to have kind of this overnight impact or a very quick impact, that's kind of a cause for pause for me. And just kind of use your logical sense that you would with anything else, right? If you were to hear that about a weight loss product or a medication for something else or what have you, you'd probably be a little weary of those things. So I would suggest that you take that same lens when you hear things like that about autism and ABA and other types of treatment for autism. If it's claiming to have a very quick fix and, autism's quote unquote gone, well, that's not likely to be true. I also definitely suggest that if you see something or you read something and you think that kind of sounds like that's something that I want for my child or myself, get somebody else's opinion who doesn't have an emotional connection to the situation. Because often, obviously, as parents and as ourselves, we want things to go well. We want to see people be independent and live the lives that they want to live. And especially as parents, there's a big emotional connection there. which is perfectly normal, and you can use that to your advantage to advocate for services. But it's also a good idea to have that second opinion for somebody who's kind of a neutral ground, who could maybe see that this kind of seems too good to be true. So it seems like maybe this would not be what you're looking for.
I think the parallel between, like the miracle weight loss pill, or like the product that guarantees to get you a six pack and,
Right.
in 15 days is such a good parallel, because we do want the best for kids, the best for like our consumers, the best for families. And unfortunately, there is that emotional tie to it, and sometimes that can like cloud judgment, or we could just be so desperate that that it can make something. We can throw a little bit of logic out, or sacrifice a little bit of logic for hope.
Yeah, absolutely.
And I think it's really great advice too, to find that neutral party, that someone who's not emotionally connected, to really like sit back and give you some advice, somebody you trust. So that's really great advice as well. Thank you for that. There's a lot of stories about autism. There's a lot of things on the internet. Again, that's probably where most of our research comes from, for better or for worse. And with these stories, there are going to be stories about this. We'll talk about ABA specifically. ABA changed my kid's life. My kid is talking now. My kid finds it easy to make friends now. My kid's sleeps through the night, is toilet trained. There's all these really wonderful stories about ABA. There's also some negative stories, about ABA with, buzz terms like PTSD and all sorts of things. So if you're advising a parent, how do you have them consider stories at all, both positive and negative? How do you advise them to navigate all of the just copious amounts of just anecdotal information that's coming from all of these different people online?
It's a good question. And first, I want to acknowledge that once an autism diagnosis occurs, there's kind of this huge wave, like this tsunami wave of information to process, in terms of what does that mean? What do I do next? What is the right service that I'm looking for? There's also, if you're getting school services through an IEP, that's a whole other wave of information. So it's a lot to process and navigate, first of all. And it can be really difficult to do that. So having some people in your corner that can help you through that is going to be really key. But in terms of, things that you might read or hear in relation to autism and applied behavior analysis, you're of course going to hear good and bad, like you just said, but then always keep in mind that people tend to voice their opinion about something when they're not happy. Versus when they are. So you're likely to see maybe more negative information than positive for that reason, just like you would see many more negative reviews about a restaurant than positive, because people tend to post reviews when they're angry about something. No, that's not to say that those negative reviews of ABA aren't valid. They certainly, I don't want to discount anyone's lived experience, and that goes for of children who maybe weren't happy with their ABA services, a person with autism who feels that it was not good for them and it resulted in some damage long term. That certainly could be the case, which is very unfortunate to hear, and I hate to hear that. But it's important to be aware, and I think it's a good reminder, actually, that there's bad ABA out there. Again, just like there's going to be those medical doctors that just aren't doing good work, there's going to be contractors that are a little bit shady. There's people who really, unfortunately, don't do good work in ABA. So as a parent or a person with autism, it's going to be important that you can start to identify the good ABA providers versus the not so good, and really look for kind of those red flags that will help you determine what kind of ABA services you're actually going into. And, part of that, get familiar with our ethics code and behavior analysis and what board certified behavior analysts are obligated to follow in order to maintain their certification. And if right off the bat it seems like maybe that's not the case with one of those ethics codes, then that should be a huge red flag there, that maybe this isn't the best type of ABA. Because when it's good ABA, there's very meaningful, important changes that can happen and often do.
What are some of the most common misconceptions that you've seen, heard, read about ABA? And maybe if you could just like tell us how those are corrected, how could they be fixed as far as like accuracy goes, or if they're just flat out incorrect?
Yeah, absolutely. One of the big ones that I continue to hear to this day is that ABA is just basically compliance training. That we're, teaching these individuals to comply no matter what the instruction is. We're not allowing the individuals or those involved with that individual to have a voice about what it is that they're learning. And again, unfortunately, that might have been true for some people receiving those services who were, unfortunately receiving not very good ABA. Now, if you're receiving good ABA, that certainly will not be the case. There are some instructions it's important to comply to in life, right? If you're about to walk into the street, for example, and there's a huge truck coming down the road and somebody yells stop, well, it'd be important that you understand how to respond to that instruction. But it's also important to teach individuals when it's appropriate to say no, and advocate for themselves when they don't want to do something, and to teach appropriate refusal behaviors. So if you're getting good ABA, that should be a focus of the program, of creating that independent communication to voice that person's wants and needs, whether it's yes, no, I want this, I don't want this, I'd like to do that, I don't want to do that, I don't want to talk to that person, I do want to talk to this person. So advocating for functional communication should be kind of the cornerstone of any really good ABA program.
I love that.
On top of compliance training, you also might hear, that ABA is kind of just teaching people to be robots. And it looks very unnatural in terms of the therapy being received. And again, that unfortunately might be the case for some people out there. And, back in the day when ABA started, some of that was a little bit more apparent in terms of this kind of drill and kill mentality of, trial after trial after trial in the same exact way. But again, that was when ABA first started, and, a lot of people didn't know what they were doing, to be honest. Now it's evolved to the point where we know what works, we know what doesn't work. We know that some individuals prefer and do well with repeated trials, temporarily, and then going very quickly to natural type of teaching. But a lot of individuals do very well with just natural teaching in the natural environment, and you can still get a lot of meaningful gains that way. So again, if you're getting good ABA, the type of therapy and the way that it looks is going to be individualized to that specific person and what works best for them and what they actually prefer. So if you think that ABA is training kind of this robotic kind of language, well, you probably experience really bad ABA.
Mm-hmm. Yeah, I've looked on YouTube for a lot of like training videos, for my own staff. That it is very commonly that drill and repetitive kind of nature without consideration for moving into how this is going to apply to real life. So hopefully we can get beyond like whatever's on YouTube, or we can get someone who's like really talented to put better things on YouTube. Any other like major misconceptions that you think would be helpful for people to know about or respond to when they see?
Yeah, another one that has come up, I think, more often recently is focusing on these type of stereotypical behaviors in the autism community. And what that means for anyone who's not familiar with that term, it's these type of behaviors that they look a little bit repetitive in nature. So it might be some hand flapping, it might be some rocking back and forth, or things of that nature. And, we all have those type of behaviors. Anyone does. So like right now I'm picking up my nails off screen, for example, and that would be considered a type of stereotypical behavior. It has this kind of automatic reinforcement. Just the behavior itself is reinforcing for some reason. So we all engage in those. It's just we learn, throughout our lives of, when it's okay to engage in those behaviors, how to make them a little bit more discreet, and when it might not be necessarily the best time to engage in those behaviors. So you might hear that, ABA is inappropriately targeting the reduction or elimination of stereotypical behaviors. And if that's the case where that is a treatment goal for either your child or you as a client, there's a couple questions to consider. So first, is that stereotypical behavior actually harmful in any way? Because if it is, we want to make sure that we're preventing harm. But if it's not, it's just repetitive, well, have we actually done a thorough evaluation of why that person is engaging in that behavior? And again, as long as it's not harmful, is it getting in the way of learning? Because if it's not getting in the way of learning, if it's not getting in the way of doing the things that that person actually wants to do in life, why would we target it? But if it is getting in the way of learning, so for example, there might be, somebody is moving their hands back and forth in front of their eyes constantly, so they can't attend to anything visual going on. That's, has some important implications in terms of safety and things of that nature. So that might be something where we target, it's okay that you do that. But let's teach you some times where, you can do that all you want versus no, it's time to pay attention, and you can do it a little bit more discreetly and still pay attention. And, later on in life, going to job interviews, driving a car, there's certain things where, those type of things might be incompatible with those type of behaviors. So it's important to understand, in this situation, I'm going to hold off on that behavior until it's safe to engage in it again. So those are the type of questions you should be asking your practitioner. Why are we doing it this way versus not this way? And what about this, in terms of, is it dangerous? Is it getting in the way of learning? Have we established when it's safe to do it and it's not safe to do it, or it's appropriate versus inappropriate?
I think the most important thing, as far as empowering anyone who's receiving services, whether it's family or the person themselves, is to be able to ask why. And then as practitioners, we should be able to fluently and satisfactorily answer that question. If we can't, then we're probably not doing good ABA. Or if we are, we're stumbling onto it rather than competently doing it. So I love that part of your answer as well.
Absolutely. Yeah. And that's, the other thing, if you ask your practitioner, why are we doing this? And their response is something along the lines of, well, this is the way that we've always done it. Boy, that is not the answer that you want to hear. And that should be a huge red flag for you. There should be a competent, individualized answer for why that's happening, no matter what it is. If it's a reduction of some type of behavior, if it's a skill acquisition, community-based supports, what have you, there should be an individualized reason for targeting that for any specific person.
Absolutely. And it's, I guess it's the definition of individualized, but I think it is important to point out that it is so different for different people. Even if it looks the same, it could be different or important to different people on a different scale. So
and it's important for parents too to speak up if something that's proposed as being targeted just is not what you're looking for in terms of how your life works. Whether that's because, how your family works as a dynamic, whether it's because of, cultural differences, speaking up and saying, what, that actually is not important to us. That's not a focus of what we're looking for. These things are, though, however. And that's really important for parents and individuals receiving services to speak up about if they're thinking, I don't know about this target. And it's equally important for practitioners, if there is something proposed to target and you're getting some pushback on that, you should be able to explain why that is important, because sometimes it's not apparent. right off the bat. You might be targeting the skill here, and it seems kind of a little bit silly, but the reason that we target this skill is because it's a prerequisite for 10 other skills that come later. So being able to explain the reasoning from the practitioner side, and also being respectful and mindful that still in that circumstance, there might be expectations on the family side that just don't meet together, and it's not necessarily seeing things on the same page, and that's okay. You can still make meaningful progress.
Was there anything else, like, do you have anything that we missed or that you want to chat more about?
I mean, one of the things that I will say is, ABA is, it can be very, very effective, but it might not be for everyone, and that's okay. If something works better for you and you know that, that's fine. But it's important to understand that because it worked for you, it doesn't mean that it'll work for somebody else. So again, ABA is very research-based. It's documented as being very successful. If it's good ABA, again, there's some bad out there, but it doesn't necessarily mean it's going to be the best fit for you. So you have to advocate for yourself and your child about what's going to be the best.
I think that's, absolutely so critical, because really I think a huge part of what we do is we teach advocacy skills, and so for families to feel like they can do that, or for each individual to feel like they can do that, I think it's just paramount to success and just overall well-being.
Absolutely.
Perfect. Well, Dr. Hanson, thank you so much for donating your time. We've really just been so lucky to learn from you today, and I think there's so many. I'm sure there's so much more, and we could talk about. We could do a whole podcast on just ABA in general, but I think this is such a good start, and I just really appreciate you taking the time to educate all of us.
Absolutely. Thank you again for having me.
Can you talk really quickly about what, like, even after you Googled it, you saw some negative reviews, some bad experiences, parents and Facebook groups were against ABA and advocating against ABA. What made you go through with it? And not only that, but stick with it even after getting misplaced on the waiting list and then messing up your email. It seems like it'd be really easy to just not do that.
For me, it was what I was doing was not working. I was failing my child. I felt like a failure to my child. I felt like I wasn't the right guy for the job. And that made me pretty depressed. I got to be honest. And it was tough on us both, emotionally, mentally, physically. I mean, watching the way that he would run at us, and especially Shamra, because he knew he could get a bigger reaction out of me, especially if he hurt my wife. And that it was hard for me because I didn't have any tools in my box. I had nothing. And I didn't want to be that failure. I wanted to succeed, and I needed something else. And so I decided to trust the process. That was, for me, that was kind of why I just wanted to stick with it and see what we could get out of it, because we were at our wits' end. We had no idea what to do. We would sit at night and just kind of slump our shoulders and go, what are we supposed to do here?
Yeah, it's about the same for me. And I know that I was getting to a point where I was getting so overwhelmed that I was starting to get more physical back with him. And, it's like, well, fine. If you're going to hit me, then I'm going to hit you back, and I'd smack his butt. Or, there were times that he would bite. And so I would bite him back very softly. I wouldn't leave marks or anything, but it got to a point where it was starting to be more physical back. And I was afraid of us ending up going more toward being abusive and actually starting to physically abuse him, because of he would just keep escalating and escalating, and he would attack his siblings. And it was just so frustrating that he didn't deserve it. We didn't deserve it. The other kids in the house didn't deserve it. And we knew if something didn't happen, chances are we weren't going to be able to stay the family that we were, because either he was going to have to be removed or all of the kids would be removed or something. It was very, very hard. It was very terrifying.
And it was hard on the two older children too. They definitely were feeling the effects of everything going on in the house, because all of our lives revolved around, initially Jareth. Um, Lily didn't have the aggressive behaviors that Jareth did. Hers were more, she would just shut down, and it was frustrating trying to get her to do things, or to get her to respond or try things or whatever we were trying to do. And so hers weren't the aggressive behaviors that Jareth did, but it was taxing everything. And it was taking everything we had to just try and keep things moving from day to day, and it was exhausting. And so regardless of what we saw online, we knew we had to do something, and we were going to see where that path took us. And my cousin, he just received the diagnosis. And I don't know what drove them to get the diagnosis or do the testing to begin with. I know that they saw certain signs. I'm not sure exactly what those were, but I know that he reached out to me after getting that, because he found out that we were, where we were, and we had been through what we'd been through. And him and his wife had gone through and done a lot of Googling, and she was terrified of the things that she saw online. And one thing that I told them, when they came over to talk, because they needed someone to connect with that had been through this. And I said, it's not just about going through ABA, it's who you do it with. It's researching the companies and understanding what their policies are and the kind of ABA that they do, and making sure that you get the right people for your family.
Well, and to add on to that as well, it's not even just the company. It's the right RBT. It's the right BCBA. We had several different RBTs with Jareth, and there was at least one of them that we said, we need to find someone else. This person is not working out with us. And that's totally fine. You have to find the right fit for you and for your child. It doesn't mean that the person that you don't want to work with is not a good person. It just means that they're not quite the right fit for you. We would also have some people come in, and they would shadow the RBT that we had. And I remember one of the people that came in and was training and shadowing, after that session, I said, I don't want her to come back because she didn't understand how literal Jareth can be. And she was telling him that a cat in a tree is an emergency. And I'm like, don't tell him that, because he will think he needs to call 911 and get everyone out here if he sees a cat in a tree. And so it's totally fine to say, I really don't think this is working out with this person. Can we try somebody else, or can we try a different way of doing it? Or, totally be open and do what you need to do to make sure that you have the right fit.
A huge thanks to Dr. Hanson. I know she's so busy, and I just really appreciate the time that she spent kind of walking us through some of these complicated issues in behavior analysis. She explains it simply. Applied behavior analysis, or ABA, is just a systematic, data-driven way of teaching people. Learner involvement should be of the utmost importance to an ABA provider. There's just so much information out there about ABA. It's important to recognize or identify resources that are reliable and that are going to adequately describe what ABA should look like, and maybe even what questions people might be interested in asking as they're seeking out an ABA provider. ABA should be individualized to each person. So be empowered to ask those questions or express something you don't agree with after ABA starts. It's not ever a personal attack. It's being an advocate for the person and services. And I think that's really important. I think it's really, really empowering. those are my takeaways from Dr. Hanson. If you have questions for Dr. Hanson, we'll forward them along. Email us at autismnavigationpod@outlook.com.